Hi, my name's Jessica. Today I'm going to be demonstrating how to insert an IV. So this is my patient, Mr. Smith. I have identified him by two identifiers and compared it to his bracelet. I have verified his order and I have checked that he has no known allergies to any adhesives or skin antiseptics. He has no AV fistulas and of course no mastectomy. Nothing that would interfere with placing an IV into this arm, and he's had IVs, but he's never had bad sticks before. So to start out, what I'm going to do is I'm going to say, hi, Mr. Smith. I'm going to be putting your IV in today. So I'm going to put this tourniquet on your arm in order to assess your veins. So put the tourniquet on. I'm going to check his radial pulse, which feels fine. Going to assess his veins, and it looks like he has a really good cephalic vein to stick. So that's the one I'm going to use today. So unpop the tourniquet. I've set up all my supplies, I've got them ready. I am going to use the cleaner to clean his arm back and forth, back and forth, back and forth, up and down, for 30 seconds. And of course, before I've done this, I've made sure he doesn't have any hair that needs to be clipped, which he doesn't. So while that dries, I'm going to get my bolus and my extension tube ready. Of course, wearing gloves and being sterile with it. All right, so that's all dry. I'm gonna get you ready to get your IV in. Are you doing okay? I know these are sterile gloves, but I'm just going to use them as if they are clean. Of course, I've washed my hands before putting these on. All right, so I am going to retie the tourniquet so that my veins are nice and pumped up and I don't infiltrate. I'm going to pop my needle out. And, all right, Mr. Smith, make sure the bubble's up. You're gonna have a little stick here on the count of 3. 1, 2, 3. All right, so now that the needle's halfway through, I'm going to advance the catheter and pull the needle out with the safety device, place it in the sharp spin. So I'm going to push down and occlude the vein. And push the catheter all the way in. And keep occluding the vein. Do not tape over the hub. Occluding the vein. And connect the saline. And make sure it's patent. Don't have any pain with that. No swelling or anything. And he's all good to go. And of course, clean up any blood that's there and put the see-through bandage on, and he is done, and I'm going to go and document.